All right, everybody, welcome to our third week of regional report out calls. This is the call on December 29th for South Central Kansas. And we're glad you could be here with us here tucked between Christmas and New Year's. Want to just give some of the regular information I like to before the calls. I'm John Rolfe. I'm your host on these calls. And if you would like to get an email with the video of this call and the dashboard that we discuss, go to covid.ks.gov. That's covid.ks.gov/report-outs. covid.ks.gov/report-outs, and get sent as soon as this is over. And then you can also send us comments, questions you'd like discussed. If you go to ksregionalreport@gmail.com, just tell us you're talking about the South Central region. ksregionalreport@gmail.com. And if you're looking for a free COVID test, the site to go to is gogettested.com/Kansas. gogettested.com/Kansas. You can find testing sites near you. There we go. Welcome to the call, everybody. What we'll do here is we'll start with the dashboard that the Kansas Hospital Association provides for us. Now, this is data from yesterday, December 28th, looking at the trailing week. And let me put that up real quick. Oh, Megan, can you make me the host so that I can put that up?
I have you as the host.
Oh,
did you click the button?
Let me try it again. It said host disabled, attendees sharing. Let's try it again. If you can share that. And I'll start walking you through it until we get to that point here. So a higher percentage of hospitals anticipate staffing shortages this week. I'm sure some of that is related to the holidays, but we're over half at 52% of the 31 hospitals here. Yeah, Meg, I'm still not able to do it.
I gave the wrong John host duties. John, can you click the button and you know how to change that over to host on participants?
If you come over on top of my screen, John, and you click the three little dots, you can make me the host. Thank you, John. We appreciate that. John's our special guest from Hutch Regional. We'll be getting to him here a little bit later. Once he's able. John, did you understand how to do that? You have to click on my screen to move it.
And make it down on the bottom right of the participant list. Can you reclaim the host?
I can. Hold on. I got it.
Oh, there we go. How about that? All right. We can get through it all. Thank you all very much. All right. I'm the host. Here you go. All right. Without further ado, here's the dashboard. Okay. So when you look, I was talking about the staffing shortage, something that we like to watch every week. You've heard us say it, and we'll say it over and over. Staff, stuff, or space is generally the issue for hospitals. Staff has been the core issue most recently, and an issue this week with over half the hospitals, just over half the hospitals anticipating staffing shortages. Then we come down and I like to look at adult staffed ICU beds available. So that's 29 of the 281 in this region are available. That's 10%. That's pretty tight. Now, again, these are static numbers in a very dynamic and fluid environment. So those do change throughout the day. And then I will promise you next week, I'll give a little more info around this statistic, which is just the trailing day. I think everything else is the trailing week. And so we're working on that. The governor had asked about that this week on that report out. Now we're seeing some good things here from the total cases in South Central Kansas. Saw that peak come up in November, and it has come down from that. Now the testing numbers were lower this past week because of the holiday. And I'll just preemptively scoot over to that. Did the screen change there when I did that?
Yes, it did.
Okay, so this is KDHE's stat site. If you click on the hospital capacity, I just want to show everybody where this is at. and hopefully it will work for us. It's not wanting to, is it? Well, we'll come back to that. Oh, here we go. If you go to HCC percent positive down there on the bottom right, under hospital capacity, the KDHE is broken out by region, what's going from a positivity rate with these colors, and you can see the coding down here at the bottom. So now third from the bottom is South Central. So you can see here, if you look, you can see the number of tests that were generally being run in a week, 20,000, 22,000, 21,000, 18,000, and this past week it dropped to 11,000, and that's just because of the holidays. So roughly half the tests that are normally run, and the percent positive, dropped from something that was in that 15 to just over 20% range. We'd gotten up to 24% at 1 week. This past week on the lower testing was at 14.5%, still very high. And this week, though, we're only 139 tests in. We're at a 30% positivity rate so far this week, but still early on that number. So back over to this. So all that feeds into the number of cases and what's going on with that. And then here's the second page of the dashboard if you want to see the percent of the population that's tested positive for COVID in each of the counties, and what's going on with the census on ICU beds as far as how many are filled with COVID patients versus non-COVID patients. And important just to understand that generally there's enough people needing care from a non-COVID standpoint this time of year that the hospitals are near capacity generally anyway this time of year. So, but we can come back to that a little bit later. All right, so that's the breakdown on where we're at from the dashboard standpoint. And I'll ask our friend Seth Conkle, who's working with Sedgwick County Health Department, to give us an update from the public health side. Seth?
Yeah, thanks, John. So I got two pieces of good news about, or two pieces of news about testing, a good piece and a bad piece, and then we're going to jump into a good piece and a bad piece of news about vaccine. So the good news about from public health perspective is that the case counts have gone down. Last week I had reported that of all of the counties in South Central Kansas, we only had 2 that were not red, and those 2 counties were still in that yellow category, which is a little bit higher than we want them to be, up in the 5 to 10% positivity range. Well, this week I'm happy to report we have 2 counties that are in the green, so they're 5% or less. We have 4 counties that are in the yellow, so that's that 5 to 10%. And then the rest of the counties, unfortunately, are still in the red. So that's the good news is we are seeing more counties get into that green level. The bad news is that COVID's still alive and well in South Central Kansas, and not going anywhere anytime soon. So don't let those decreasing numbers fool you. You still need to continue to hand sanitize. You still need to socially distance. And you still need to wear your mask. I think the other focus in the last couple of weeks that we've seen from a public health perspective would be the shift to the vaccine. We do have 2 vaccines that have been authorized for use in the United States. And those vaccines have been reaching healthcare workers, specifically those in hospitals, long-term care, public health, and EMS workers, and expanding out to other healthcare associated workers, doctors' offices, nurses, frontline medical staff, those types of people. So that's the good news. The vaccine is here. It is in Kansas, and it is actively day to day being administered. The bad news is we don't have enough for everybody, but we're not talking, it's now months and years away. We're talking it's months away from getting to where we can start vaccinating the general public. And so I think that's a positive in this, what's been almost a full year now. We do see some light at the end of the tunnel. So I'm excited about that. And John, I'll turn it back over to you unless there's any questions.
Thank you, Seth. When we have more information on vaccine rollout too, we'll make sure we share those as it comes to public. Obviously, the frontline healthcare workers are first, and then they'll be coming down from there. But that is good news. Thank you, Seth. Appreciate that. Let me pass it over to Dee Dee. Dee Dee, can you introduce yourself to everybody?
Thanks. I'm Dee Dee Jewell. I'm with Ascension Via Christi, and I represent really outreach for Ascension Via Christi, and as well as support 9 critical access hospitals in this region that form a rural health network. And then in my capacity here for these report outs, I'm actually representing 31 hospitals that stretch across our 15 county region here. So I really only had a couple of added comments that I'd like to make in response to John and Seth's on the dashboard. And really that's giving a little more color to some of the individual hospitals within the region, because overall, you know, we've seen that the hospitalizations are actually up slightly from the past week overall, but some of the communities and some of the hospitals are actually experiencing some noted declines in COVID inpatients, which they are feeling very encouraged about. But of course, the ICU bed situation is still, you know, remains a premium everywhere, whether they are with COVID patients or non-COVID patients. So we're still seeing quite a bit of activity in the ICUs. And of course, the staffing challenges, as we noted, continue at various levels for various reasons across most of the hospitals, with trying to utilize contract staffing where they can if they have them available. And then, you know, it's interesting within the different regions or within the different communities, like in Hutchinson, for instance, they're really enjoying a little bit of a decline there and getting a little bit of a breather there, and very excited, of course, to continue with the vaccinations, while some of the other communities are still really seeing about the same levels of COVID inpatients and ICU utilization, as well as, you know, some decline in some areas with ventilator use and some about the same. So there's just kind of a slight variation across, which just kind of tells, you know, each community has its own story, and I think that that's very important to note. Also, you know, they're continuing to be concerned with people maybe avoiding care or putting off care. So that's noted, of course, by ER visits being down, some clinic visits being down while others aren't, as well as even the inpatient censuses, you know, what you would normally see this time of year with different diagnoses are seeing a slight decline. So all of that indicates that we still think there's care avoidance, and of course, you know, continue that strong messaging to please seek care when you need it, so it does not advance to a more critical stage. You know, everybody's just kind of holding their breath now as we get through the holidays to see if we're going to stay steady or see that surge happen from social gatherings and things like that. So we just continue that strong messaging, of course, to take all those necessary precautions, and just continue to be happy about the vaccinations as they continue to roll out to the next level of healthcare givers and essential workers. That's really all I have. Do you have anything to add there, John?
Do you have any sense of how the major hospitals are doing in Wichita when you talk about how things are going?
You see you know, with that increase in the hospitalizations and the ICUs, I do know that the hospitals do continue to be very busy. Our ICUs are still very, very much full. While I still feel there is a little more room now where I feel like we have more cushion as we're taking more transfer patients, especially the non-COVID ones, being able to take some of those transfer patients, whereas, you know, there for a while, our hospitals just were quite full and not able to accommodate those requests. I feel like we have a little more room there.
You have a guest with us today. You want to introduce him and hear a little bit from boots on the ground?
I'd like to introduce John Miller, who is with us. He's a very experienced ICU nurse from Hutchinson Regional Medical Center. And I just had to add, because I think our healthcare workers don't get enough props, so I just had to mention that John's CEO described him as a valued team member, mentor, coach, trainer, and strong, passionate patient advocate. So with that, I introduced John Miller, ICU nurse from Hutchinson, and would love for you to tell us a little bit about your COVID experiences there.
Thank you for this opportunity to be with you this afternoon. very early on, I think one of the things that I really came upon was a virus is impersonal. It doesn't indiscriminate about who it affects, from age to political persuasion, socioeconomic status. Just kind of crosses over all of that, and just in that process, as this came on very early on, thinking about, I signed up to be a nurse a long time ago, almost 30 years ago, and this is a part of what I signed up for. I didn't know that, but quickly being able to adjust into that, and the wearing of a mask, and then wearing the protective face shield. It's actually like a construction helmet with little air vents in the top, and there's a battery pack that connects to that, so it's blowing cool air through that. So it's a whole different way to practice. It's a little more preparation to be able to do that. But the care, and what I found with these kind of patients is just the level of intensity. And it seemed like from day in and day out, it's just kind of more of the same. Some people recover, albeit slowly, and others that was not going to be a part of their story. And just the other part of the dynamic, there's nothing like the hospital experience and being able to have loved ones come in, spend time. We redid our ICU here a number of years ago with the express purpose of having like a day bed, or it flips into a bed at night, for families to be able to stay with their loved one. That's a patient's family satisfier. But in this time, it's the patient pretty much goes it alone. We're blessed to have. We're on the ground floor, and our new construction is in a circular design, and there's lots of window space. So that's really nice, and particularly with this, families can come to the windows and look in to see their loved one. We can coordinate to be able to turn the bed so that they can look out and see their loved ones and communicate. So that's just been a part of that. And in one case I'm thinking in particular that had to do with that was a patient, and this was a personal acquaintance, and this is when it hits close to home. A personal family friend that I've known for 20 plus years was admitted, and he's elderly in his 80s, and he just really seemed to be discouraged. Had the opportunity to be able to visit with his pastor, and set up. His pastor was instrumental in getting the wife, who was in quarantine herself, and feeling that separation, ended up having her come. We coordinated a time. I turned the bed. Wife was able to come to the window and spend some time, and that really seemed to help this patient. His spirits picked up, and even though he had a longer time to go, that really seemed to make a difference for him. There's 3 different cases of patients that I can think of as far as in the course, and I've thought for a long time, patients and families teach me a lot about life and how to respond, and other ways that everyone has their own coping mechanism, and then we're just there to be present and respond in kind to what they're in need of. Had the patient who had come in, there's a certain kind of oxygen therapy that we use. It's the prongs in the nose, but it's you can turn it up to a high rate, and it's heated oxygen. And he came in and just got to a point where it seemed like his condition, he didn't require the ventilator, but he had just kind of plateaued. And I came on shift one morning, and the report I got was that this gentleman had a talk with God the night before. He had made his peace, and he decided he was going to go comfort care. And so we work with that. One of the other observations I've made is, medicine, we can offer a lot. There's always choices and treatments that we can try, but there's nothing like the family or the patient in this case who could step forward and say, I've given this a good ride, and I'm ready to stop. And so he was able to go comfort care, lasted a number of weeks out of the ICU setting, and before his death. Another case had to involve, I talked about it's no respecter of persons. This person was from our local correctional facility, and he was one that came in that it just didn't seem like his recovery was going to be, it was not going to be possible. but we continue to work with him. The longer term option for someone that we usually put the endotracheal tube down through the throat into the trachea. And after there's complications that at some point, if it's going to be a longer haul, we make an opening in the surgeon makes an opening in the trachea or in the throat base of the neck and puts a tube in that way. With this gentleman happily rehab for a number of weeks, and I have a source from the correctional facility to say that he not only has gone back, but he is up walking around and is doing well. He has a ways to go. I don't know what his final clinical picture will look like. But he has done well. And then I think lastly, another example that I thought of for patients is the one who comes in, a very successful business person, would be beyond what we call retirement age, but was still very actively engaged. And he came in and we were having the conversation as the physicians tactfully do in regards to what the outcome could be. And if he wanted to have the breathing tube, if that was necessary, yeah, I'd like to do all that. And I remember thinking, not in a pessimistic way, but because of age and just how he was coming in. And I'm thinking, you know, how is this going to go for him? It proceeded along. He ended up on the ventilator. And after a certain point, it reached that it saw that he was not going to recover. The decision was made for the family to have him go to what we refer to as comfort care, to come off the ventilator and just allow to go peacefully with medicines as needed for comfort. So yeah, that part and in the midst of all that though is what I've come to recognize is the value of each of the team members of the system, and that can be from the physician to the care provider, the nurse practitioners, to the support services of pharmacy, environmental services, the housekeeping department, lab. We all are in this together, and we seek to find solutions to make as a way to make that work. As it relates to being a nurse, one of the things that happens with these patients in order for efficiency, when these patients are in these rooms, the doors are closed. There's the slow, quiet roar of it's called a HEPA filter, which helps filter the air within the system. They're negative pressure rooms, but it's part of what we have in the unit. So there's just a lot of, and we try to minimize being able to go into those rooms as we can. So part of that is to have your IV pump sitting outside, and we string together extension tubing that are each 35 inches long, and you put 6 of those end to end, and that's enough to get from the outside of the room into where that connects to the patient. So there's a lot of changing of when the medication runs out, or medications to help them be restful to change out, and having staff members. If I go by and see a staff member's medication being low enough to go get another bottle and have that ready to go. There's just a lot of teamwork, people working together. And again, to just emphasize what has been helpful in that is to recognize we're in this together, working together. But also, one final comment is about the support of the community. There's been a rally, and people who've had loved ones in the hospital who can get the word out, invited people to bring in snacks and care packages, and we've even had meals. And one of the things I think I'll always remember, on the walkway from the employee entrance to the parking lot, there were children who came in and drew sidewalk chalk. Various messages talked about, we're supporting you, and there's nothing been like that. I will take that from this experience amidst the disappointment and the awareness of what we're dealing with. The number of deaths from the middle of November, it seemed, to the first part of into December, seemed like we had more people succumbing to the effects of COVID than we had getting out of ICU, and recognizing that takes a toll, but to find the resources both outside of the hospital and within to find a way to make this through together.
John, thank you very much. Those are really well-chosen stories to help highlight the reality of what you and your teams are facing every day in the hospital, and the care that's in your voice. Anybody would be lucky to have you caring for their family member or themselves. So I can see why your CEO thinks so much of you. Thank you for giving some of your time over today for this call. I'm going to pitch it to Dr. Watson if he can give us a quick rundown on what's going on with the transfer situation in the state from the Mission Control software. Dr. Watson.
Yeah, hi, Richard Watson, Kansas physician, one of the founders of Shine Mountain Software, a software that links sending hospitals with receiving hospitals and transporters together. And I'll show you the dashboard that we monitor for monitoring movement of patients in the state. And I think the tidbits that I want to take away are, particularly for this region, are the COVID percentage of the people that we're moving now has come down slightly. The acuity level, the how sick they are, a little bit better than it has been previously. I think this is good where we've seen the transport times, the wait before the patient's able to be moved is globally about an hour and 15 minutes. I do want to say that when we look for a bed, it's 3 hours and 15 minutes. So of those 40%, 35% that need assistance finding a bed, we're seeing that time is beyond 3 hours and that over half of those are still COVID positive. So, I think the word is there's certainly stability in the numbers, maybe slightly easing on severity and demand, but we know that the hospitals are still critical capacity or near critical capacity. And while we take away from this a little bit of relief that we haven't gotten worse, I think with 90 million people moving in the US over the Christmas holiday, the chances of seeing first and second week of January something different, we need to catch our breath here, but be ready for what could be ahead. Hopefully not, but certainly not a time to let up. So that would be the summary I have, John.
Thank you, Dr. Watson. Thank you. I know we're short on time here. This is the South Central region that you were highlighting there, or was that the state? Okay. Yep.
That was South Central region. Yep.
That was the data for the people paying attention to this call against South Central. 1:30 every Tuesday right here. You can sign up for an email at covid.ks.gov/report-outs. Real quick before we get off, I want to make sure, like anytime, there's bad human behavior out there, and there are COVID-19 vaccine scams going on. And so just 3 bullet points for you to be aware of and to share with your friends and neighbors. And I think we're trying to attach this to the email too. But you will never be asked for money to enhance your ranking for the vaccine eligibility. 2, the government and state officials will not call you to obtain personal information in order to receive the vaccine. And 3, you will not be solicited door to door to receive the vaccine. So I'm going to go over those real quick. You're not ever going to be asked for money to enhance your position in line. Government and state officials will not call to get personal information from you over the phone. And you will not be solicited door to door for the vaccine. So you can help share that word as well. Also, friends at Kansas Chamber of Commerce are asking us just to help make people aware of the unemployment fraud that's going on out there. It's been going on for several months across our state and other states, but something to be aware that someone might be trying to file for unemployment under your name. We'll try and get more details from the Department of Labor on that also in the future. I had a couple bright spots, but John Miller, your stories, I love the story about the children with the chalk, to hear how meaningful that was to you. A simple act of kindness, of involving other people, whoever put that together, involved all those kids in helping create positivity in such a hard time. So thank you for sharing that story. That'll be our bright spot for this week. And just appreciate everybody for sharing time here. Seth, Dee Dee, John, Dr. Watson, anything you'd like to add before we wrap up?
No.
Okay. We wish everybody a happy holiday and a happy new year. We'll see you next year on Tuesday at 1:30. Thank you very much.